So in this video, I want to introduce you to some other CBT skills that can help you if you notice that your thoughts tend to be recycling along the same negative things, if you notice that you tend to ruminate, if you're preoccupied by certain things. CBT can be a great help. And of course, CBT stands for Cognitive Behavioral Therapy. So when we teach CBT as clinicians, we not only teach people how to change their thinking, but we also talk about behaviors that can go along with those thinking skills to help reach the goal of having a more positive environment up here in the mind. You'll notice that another video in this series is reframing. That's what I call the meat and potatoes of CBT. It's the easiest skill for people to learn, and a premise of reframing is that you have learned how to belly breathe, and you have learned the skill of mindfulness. You may not be advanced in those practices yet, but it's important that you learn how to breathe rhythmically, because this helps slow down the hyperarousal that's involved with stress and anxiety, and gives you a chance to focus here in the seat of consciousness, right in the front of the brain, where our executive functioning is located. Executive functioning means all of our learning skills: focus, attention, remembering. That's what we need to engage when we're doing CBT, to sort out all the mush that might be back here. So once you've learned the skill of reframing, there are some other little tricks that you can do when you notice negative thoughts keep popping up. And remember from the first video that our operational beliefs are sort of the unconscious seat of those thoughts, and negative thoughts pop up as well as positive thoughts, but we've got thoughts popcorning up all day. Our minds aren't very quiet, and they're not supposed to be that way. But we can help turn some of that noise down, and we can help adapt so that that noise is not always negative through the following skills that I'm going to teach. So the first skill is setting aside until later. If you notice that you're preoccupied by a certain event, by a certain hurt, even by a certain exciting thing that's coming up in your future, and it's affecting the way that you're able to focus and listen to other people that you're in relationships with, or that you can't get your work done, one little thing you can say to yourself to reformat here is, at 8 p.m. tonight, I'm going to sit down and either give myself 30 minutes to think about this or 30 minutes to write about this. It's so ridiculously simple that it sounds like it wouldn't work, but basically you're pooling your attention here and you're telling your brain, stop for a moment. I know this is important because you keep talking about it, but I'm going to come back to you, at 8 o'clock tonight, and we're going to have time to think about this. So I call that skill setting aside. It's very effective for some kinds of preoccupation, rumination, negative thoughts. The other trick to use is distraction. And distraction can be a distraction in the mind or a distraction of behavior. So again, if you notice that your thoughts are recycling and you can't break out of that cycle, you're just kind of stuck in this loop. Feels like a train is going around and around and around in your brain. One powerful way to disrupt that looping, that circling thought, is to give yourself a distraction. So a physical distraction is good because it gets you into the body. It reminds you that you have a body. It integrates you. You're not just stuck in the mush up here. So a physical way of distraction would be to get up, take a deep breath, take a stretch, go for a brisk walk, focus on the executive functioning here. Be mindful, which means just being present in the day. Be mindful and then return to the work that you're trying to do. So a mental distraction might be to think about something else, to plan your dinner this evening, to do a few minutes on a task that you need to do. Anything basically to get your mind from this thing over here that it's looping around to this thing over here. So again, that can be a physical or a behavioral distraction or a mental distraction where you kind of pull your brain from where it's looping to doing something else. So that is distraction, and that is setting aside till later. One final one that I'll talk about really briefly is thought stopping. And so the obvious criticism to this is, well, if I could, stop my thoughts, I would. Again, it's amazing how a simple visual paired with a verbal cue can really help that brain get to where you want it to be. So with thought stopping, the idea is that you don't necessarily reframe the thought or do a behavioral distraction. You just tell yourself to stop and imagine a stop sign or a halting hand, some visual in your mind that cues you to stop thinking that. Maybe a gate coming down or a hammer, Indiana Jones rolling through the gate, whatever you want to do. But thought stopping is imagine that visual cue, bring the focus to the front of the brain, to the seat of consciousness, and say, I'm not going to think about that. So what thought skill you use obviously depends upon the situation, and you have to play around with these until they work. But I think that the thought stopping one is most helpful for thoughts that you absolutely must not entertain. So there are going to be some times where you want to reframe the thought, maybe like, oh, I hate my body. So an easy reframe is, I'm learning to love my body, and you keep saying that until you reformat the thoughts and the belief, because it's a belief. It's not necessarily true. A thought stopping might be used for something that is even more hostile to yourself, like you're just ugly today. People do talk to themselves like that. And so thought stopping can be used to say, just stop. I absolutely refuse to talk to myself like that. So good luck practicing these tips. You can email me if you want further clarification, or if you want refer into resources that can help you in your journey to have a beautiful mind.